Welcome to the Health Inquiry. For decades, society has viewed depression primarily as an emotional or psychological struggle. When someone is diagnosed with depression, it is common to assume that the problem is entirely within their thoughts or is caused by a simple chemical imbalance in the brain. The standard way doctors have treated depression for over half a century focuses on correcting the chemical imbalance. They usually prescribe traditional antidepressant medications like selective serotonin reuptake inhibitors, SSRIs, or recommend counseling and talk therapy. While these treatments help many people, they do not work for everyone. In fact, about 1 out of every 3 people who try standard antidepressants do not see their symptoms improve. This reality has led medical researchers to look in entirely new directions. Today, cutting-edge medical science is pointing toward a surprising culprit: inflammation. New studies show that swelling in the body can travel to the brain, a process called neuroinflammation, and act as a driving force for depression. In the near future, anti-inflammatory therapies may become a standard part of medical care to help treat certain people living with this condition. The big picture, the massive impact of depression. To understand why this new research matters, we have to look at how common and severe depression really is. According to the World Health Organization, WHO, depression affects approximately 280 million people around the world. In the United States, data from the Centers for Disease Control and Prevention, CDC, shows that nearly 1 in 5 adults have been diagnosed with depression at some point in their lives, and its presence has risen by 60% over the past decade. Depression is not just a personal struggle. Its waves impact every level of our communities. The individual. It causes severe emotional pain, feelings of worthlessness, extreme fatigue, and changes in sleep or appetite. In its most severe forms, it can lead to devastating thoughts of self-harm or suicide. The family. When a family member has depression, it alters daily home life. It can strain relationships, make it difficult for parents to care for children, or leave family members feeling completely helpless as they watch a loved one suffer. Society as a whole. Depression is the leading cause of disability worldwide. The WHO estimates that depression and anxiety cause 12 billion lost workdays every single year, costing the global economy nearly $1 trillion in lost productivity. Because the toll on society is so massive, finding new ways to treat depression is one of the most urgent public health goals in modern medicine. Neuroinflammation, the brain's hidden fire. Scientists and doctors are increasingly realizing that inflammation is a major driver for many human diseases, from arthritis to heart disease. Now, we know it can drive depression too. Think of inflammation as your body's emergency defense system. When you get a cut, your immune system sends out special proteins to fight germs and heal the wound, causing the area to swell. However, if your body stays under chronic stress or faces a physical illness, your immune system can stay turned on for too long. These inflammatory proteins travel through your blood and enter your brain. Once inside, they cause neuroinflammation and disrupt 2 critical chemical messengers that control how you feel. Serotonin, the chemical that regulates mood, sleep, and appetite, and dopamine, the chemical that gives us energy, motivation, and a sense of reward. When neuroinflammation lowers these chemicals, a person can plunge into a depressive state. To prove this, scientists have done experiments where they safely gave healthy volunteers a substance that triggers temporary inflammation. Within hours, those volunteers began to experience clear feelings of anxiety and depression, proving that inflammation can directly cause these mental health symptoms. Inflamed depression, a distinct subgroup. Depression is highly heterogeneous, meaning it may be very different from patient to patient. The extent to which inflammation contributes to the illness varies wildly. Scientific research shows that roughly 25% of patients with depression have elevated levels of inflammatory proteins in their blood. For this specific subset of patients, neuroinflammation may be a main determinant factor causing their disease. Traditional SSRI antidepressants usually do not provide sufficient benefit. Dr. Gholam Khandakar, a professor of psychiatry at Bristol Medical School, noted that this group exhibits a unique set of physical symptoms, which he calls inflamed depression. Patients in this specific group are much more likely to experience following symptoms: severe fatigue, feeling completely drained of energy no matter how much they rest. Anhedonia, a total loss of motivation or inability to feel pleasure from favorite activities. Somatic changes, major disruptions to sleep, and a total loss of appetite. Evidence from key clinical trials. For patients with inflamed depression, anti-inflammatory treatments may exert the maximal benefit. However, because these drugs only target inflammation, they may not work for the other 75% of depressed patients who do not have immune system swelling. Therefore, the absolute key to using these therapies successfully is patient stratification, sorting patients into precise groups to select the exact treatment they need. Over the years, several landmark clinical trials have tested whether anti-inflammatory drugs can heal depression. These studies provide the scientific backbone for this new medical frontier. The infliximab study, Emory University. One of the earliest and most famous clinical trials testing this concept was led by Dr. Charles Raisin and Dr. Andrew Miller at Emory University School of Medicine. The researchers tested a powerful biologic drug called infliximab. Infliximab is a monoclonal antibody normally used to treat painful inflammatory diseases like Crohn's disease and rheumatoid arthritis. It works by blocking a key inflammatory molecule in the body called tumor necrosis factor alpha, TNF-alpha. The study looked at 60 patients who had been suffering from major depression for an average of 15 years and had not responded to standard antidepressants. Half of the patients received infusions of infliximab, while the other half received a placebo, a completely non-active fake pill or saltwater solution. When the researchers looked at all 60 patients combined as one large group, the drug appeared to be a failure. It did not perform any better than the placebo. However, the scientists then used patient stratification. They separated the data to look only at the patients who had high levels of inflammation in their blood before the study started. To measure this, they used a simple common blood test called a C-reactive protein, CRP test. When they isolated the patients who had a high CRP level, greater than 5 mg/L, the results completely changed. The patients with high inflammation who received the real drug showed a massive, statistically significant improvement in their depression symptoms compared to those who took the placebo. This historic study proved that anti-inflammatory drugs can treat depression, but only if the patient actually has high inflammation to begin with. The tocilizumab trial, University of Bristol. Building on the earlier concept, a highly anticipated clinical trial was very recently published by Dr. Ghulam Khandakar and his research team. This trial targeted a different inflammatory pathway involving a protein called interleukin-6, IL-6, which scientists know can drive depression symptoms. The team conducted a 4-week, randomized controlled trial involving 30 participants with moderate to severe treatment-resistant depression who also showed signs of low-grade inflammation in their blood. 14 participants were given a drug called tocilizumab, an existing medication typically prescribed for rheumatoid arthritis that blocks IL-6 receptors, while 16 participants received placebo. The results were incredibly encouraging. The individuals who received the tocilizumab showed a steady and clear improvement over the course of the study. The drug successfully reduced the severity of their depression, lowered their anxiety, and drastically reduced their physical fatigue, resulting in a much higher overall quality of life. Remarkably, 54% of the participants taking the anti-inflammatory medication achieved full depression remission, meaning their symptoms completely disappeared, compared to only 31% in the placebo group. Dr. Khandakar noted that while this was a smaller trial meant to establish a proof of concept, its high success rate paves the way for a massive, large-scale Phase 3 trial to bring this treatment closer to standard medical practice. The American Journal of Psychiatry meta-analysis. To ensure these findings were not just a series of lucky coincidences, a major scientific review and meta-analysis was published by researchers from the University of Michigan and Harvard University. Led by Dr. Nyoise Mcgiolabhui and Professor Annalise Madison, the researchers gathered data from multiple randomized controlled trials involving hundreds of depressed individuals who possessed an inflammatory phenotype, high markers of inflammation in their blood. The meta-analysis examined 11 different clinical trials where depressed patients with elevated inflammation, such as a CRP level of 2 mg/L or higher, were treated with various anti-inflammatory drugs. The final statistical results were clear and definitive. Anti-inflammatory treatments caused a significant reduction in overall depressive symptom severity. Even more importantly, the study found that these medications significantly reduced anhedonia, the specific, devastating symptom of depression that makes a person completely unable to feel pleasure or motivation. Standard antidepressants are notoriously bad at treating anhedonia, making this finding a massive breakthrough for public health. The researchers concluded that when doctors properly focus on the immune systems of patients, anti-inflammatory therapies are a safe and highly effective tool for fighting hard-to-treat depression. Looking ahead, a possible new standard of care. While intensive research is still ongoing in this direction, we should hold great hope for the near future. Leading experts agree that it is still too early to prescribe anti-inflammatory medications for depression at a regular doctor's visit. Many of these drugs are very strong and can have side effects, meaning more large-scale testing is required to make sure they are completely safe for psychiatric use. However, medical science is moving rapidly. In the coming years, anti-inflammatory therapy is highly expected to become a standard part of care for this specific subset of depressed patients. Instead of the old trial-and-error method, where a patient spends months or years taking traditional antidepressants that might not work, the future of psychiatry will feel much more personalized. A patient visiting a clinic for depression will likely start with a simple blood test to check their inflammation levels. If their inflammatory markers are high, the doctor may bypass traditional medications entirely and choose a targeted therapy that calms the immune system, healing the brain from the inside out. Public health and prevention, lowering inflammation today. From a public health point of view, we do not have to wait for new medications to protect our communities. Preventing and reducing inflammation through our daily lifestyle choices is a vital, proven way to maintain mental health and prevent depression from developing in the first place. We can lower body and brain inflammation naturally by focusing on 4 major pillars. 1. Diet. Eating highly processed fast foods, greasy items, and sugary sodas triggers internal inflammation over time. Eating a balanced diet full of colorful fruits, vegetables, whole grains, and fish provides the body with natural antioxidants that keep the immune system calm. 2. Exercise. Moving your body daily acts as a natural anti-inflammatory sweep. Just 20 to 30 minutes of active play, running, walking, or sports prompts muscles to release chemicals that tell the immune system to cool down. 3. Mood management. Chronic stress, anxiety, and loneliness signal the body to release inflammatory proteins. Practicing relaxation techniques, talking openly with friends, journaling, and engaging in creative hobbies keeps daily stress from turning into chronic, harmful inflammation. 4. Sleep. Getting 7 to 9 hours of quality sleep each night allows the brain to clean out cellular waste and resets the immune system. Skipping sleep throws the immune system out of balance, driving inflammation levels upward and putting extra stress on the brain. Conclusion. Depression is a heavy burden that profoundly affects individuals, families, and society as a whole. By shifting our view from a purely psychological illness to one that can be driven by physical neuroinflammation, science is opening doors to treatments that were unimaginable just a few decades ago. The clinical trials led by researchers at Emory, Bristol, Michigan, and Harvard prove that the link between the immune system and the brain is real, measurable, and treatable. While doctors continue to perfect targeted medical therapies for the future, we can use the power of public health education to protect our brains and bodies right now. By making healthy choices every day, we can quiet the hidden inflammation in our bodies, protect our minds, and build a healthier future for everyone. Thank you so much for watching The Health Inquiry. If you learned something new today, make sure to hit that subscribe button, give this video a big thumbs up, and share it with someone you care about.